These mental health problems may be the trickiest to explain to people who don't work in the field. What is personality and how can it be a disorder? Most people who think about personality would view all of us as having specific character traits. These traits are so close to who we are in terms of how we view ourselves, how we view others, how we interact with our environment. You might have taken psychological tests with a pen and paper or online, and in those tests, they might tell you about your tendency to be an introvert or an extrovert, or that you like to see new things, or that you like to be in a safe and familiar place, or any number of dimensions that add up to your unique perspective on life. A personality disorder is an enduring pattern of inner experience and outward behavior that is pervasive, inflexible, and markedly deviates from cultural expectations. These disorders cause distress and impairment in the lives of the individual and maybe even in the lives of those who interact with them. The tricky part is that the individual with the personality disorder often doesn't appreciate the problem. They often blame others for being wrong or not getting them. There are 10 recognized personality disorders. Let's take a closer look at 3 of them. Borderline personality disorder. This personality disorder is best characterized as a pattern of unstable relationships and unstable self-image. Individuals diagnosed with borderline personality disorder are often preoccupied by fears of being abandoned and may act impulsively to remedy their intense feelings of emptiness. Recurrent self-harm behaviors or suicide attempts can be a common feature of borderline personality disorder. Although about 1 to 2% of the population has borderline personality disorder, a much greater number of people seeking mental health treatment for something else may be diagnosed with borderline personality disorder. Have you ever been called a narcissist? Or have you ever called someone a narcissist? This is a great example of something I mentioned earlier. You want to be very careful and separate your use of these words in regular language outside the workplace from what's used inside the workplace in an official capacity. There's a specific diagnosis of narcissistic personality disorder with clear diagnostic criteria, and not every person on television or in real life who's called a narcissist would meet the full criteria. In order to be diagnosed with narcissistic personality disorder, a person has to have a pervasive and enduring pattern of grandiosity and need for admiration. These folks feel like they are better than everyone else, and they also carry a desire to be liked or constantly praised by others. Something that goes along with this quality is a sense of looking down on others and not feeling compassion for those who are perceived as below them. They often come across as arrogant or jealous. Now, what's challenging about people with narcissistic personality disorder is that they may actually be rewarded by their employer for their ambition or their ability to seek leadership positions. However, when you look at their lives at home or get to know them socially, you realize that those parts of their lives are failing pretty badly. If we think about someone with narcissistic personality disorder as the one who makes the rules, what about people who routinely break the rules? Antisocial personality disorder is a pervasive and enduring pattern of disregard of the rights of others. This condition begins in childhood and has a variety of names in the past. Psychopath and sociopath are some of the terms that have been used to describe people with this personality disorder before. Breaking laws, lying, failing to plan for the future, aggressiveness, and lack of remorse after hurting someone are common features of antisocial personality disorder. There's a big overlap between antisocial personality disorder and substance use disorders, and it's also not a surprise that you'll find a higher incidence of this diagnosis in prisons and in jails than in the general public. As a result, the percentage of people with antisocial personality disorder varies depending on where you look. I can't tell you how many people come to my office in their 50s or 60s worried that they're getting Alzheimer's. It seems like people expect that their ability to remember things to be as sharp when they have gray hair as when they didn't. Unfortunately, losing the sharpness of one's memory is a common factor for all human beings who are fortunate enough to age into their senior years. The people that really need attention are those who have memory disorders that are different and more severe than the issues seen with normal aging. The generally accepted term for memory disorders associated with aging is dementia. The DSM-5 uses the term neurocognitive disorder instead of dementia, so you might hear that word being thrown around. The reason they've switched to the term neurocognitive disorder is that dementia seems to imply that it's something that only happens to older folks. We are going to take a look at one neurocognitive disorder that does happen to older folks, but we're also going to look at another neurocognitive disorder that doesn't care how old you are. The most common type of dementia is Alzheimer's disease. If you make it into your 70s, you have at least a 25% chance of getting this terrible illness. Sadly, the chance of getting Alzheimer's goes up as you get older. By the time you're 85, there's a 40% chance you'll be diagnosed with Alzheimer's. This sort of memory disorder is identified by a gradual and progressive decline in memory function. The part of memory that goes first is usually short-term memory. Later on in the illness, it tends to affect all memory. In order for a person to be diagnosed with Alzheimer's, they must also have neurological problems, so a physical exam and testing by qualified professionals is essential to make the diagnosis. They could have visual problems, problems with language, problems with complex physical tasks like getting dressed or cooking. There are several other sorts of cognitive disorders besides Alzheimer's that can affect the elderly. The reason that it's essential for veteran service officers to be sensitive to these issues is that the veteran population is aging. Senior citizens are the fastest growing segment of the United States, and there are many older veterans who will need a combination of resources from their communities, their healthcare providers, and their friends and family. Remember that I mentioned that the term dementia has been kind of replaced with the newer term neurocognitive disorder? And they did this to accommodate the idea that not all memory problems affect elderly people. The memory disorder I want to remind you of at this time is traumatic brain injury, or TBI. Although TBI can have emotional and physical symptoms associated with it, the core issue that defines TBI is related to memory and cognition. As I mentioned at the beginning of this video, the goal of this review of mental disorders is not to turn everyone watching into amateur psychologists. But the better you understand the whole picture, the better you can connect your veterans to the right resources that they need. Please look forward to 2 other lectures that will address co-occurring disorders. The modules on substance use and whole health will add more dimensions to your understanding of the issues that may present when a new veteran comes into your office. The better you understand the whole person, the better you can serve them.